Hi, it's Dr. Jon Perlman, Beverly Hills plastic surgeon. I thought it would be worthwhile spending a few moments reviewing with you what you can expect after undergoing a breast reduction surgery. Many patients carry around heavy, large breasts, often double D cup or larger, and suffer back and shoulder and neck pain. And when they've undergone a breast reduction, the change can be remarkable. They can sit and stand taller, their posture is better. They can then go on to lose weight because it's easier to exercise, and the body's proportions just seem to improve. So it's a very worthwhile procedure, but the skin is delicate and the healing is extremely important. We want to do it the right way to give you the best chance of avoiding complications in healing and minimizing the incision lines or scars that will be present from the surgery. So it's a procedure you should really look forward to doing if you need it. But there's some important caveats that I warn all my patients about, and I'd like you to expect during your recovery period. Number one, extremely important to avoid smoking at least a month before surgery and at least a month or longer after. I personally encourage you to discontinue smoking permanently, but that's a personal decision that you have to make. But I would not do a breast reduction if somebody is smoking at the time of their breast reduction surgery, due to the carbon monoxide in your blood and the effect it can have on healing in the more delicate areas of the incisions. Number two, avoid blood thinners. Extremely important. We want to reduce the bruising as well as the risk of bleeding after surgery. We do leave drains in after the procedure. We want to suction out any fluid that may form, any cavities that are there we want to get rid of. And we want the tissues to readhere to themselves. So I leave drains in for a couple to several days, and have a little trick to removing them that makes it near painless. And I'll put a little stitch in where the drain was so it heals well. It's all effortless and quite easy. Do expect your chest to be swollen and your breast to be very tender after the procedure. And in a way that's good because it reminds you that you need to really reduce your activities, not exercise, and allow nature's healing to take its course. Most of the sutures that we use are absorbable and don't need to be removed. Occasionally there's one or two that we put in that we take out. But for the most part, all of these sutures are absorbable internal stitches that heal really well. On that subject, one has to realize that the exchange of benefit of having a breast reduction involves having surgical incisions. It's quite unavoidable. But the incisions allow me to do the best optimal job that I can do in terms of shaping your breasts and reducing them in a favorable manner. But we have a new device that we've been using for about a year when people want it, and most do, and that is something called Embrace tape. The tape is a mechanical tape that takes tension off the skin. We usually start using it maybe 2 to 4 weeks after the procedure and change it once a week for a period of about 8 weeks. And it's been shown, there's some pretty good data, that the incisions don't become invisible with it, but are probably, I would say, 40%, maybe to 70% less prominent and noticeable. And I've seen many studies, and so far my experience in the office has confirmed that. So I'd like you to use these tapes if they're not irritating to your skin, and for most people they're not. And that will facilitate your healing and lessening of your surgical scar. The other thing that can sometimes happen in very large-breasted women who undergo reduction is sometimes there's temporary lumps from what we call fat necrosis. There could be a little drainage of an oily fluid. It rarely happens, but it is possible. Expect to have numbness. Expect your nipples to be numb temporarily and the skin to be numb. But as the swelling goes down, for most people, but maybe not all, but for most people, the sensation returns. Rarely it's better than it was before, but sometimes it's a lessening of sensation. But many women who are that large-breasted, who are double Ds, don't have good nipple sensation to begin with, and it's not of great importance to them. But we try to maintain the innervation to the nipple as much as possible. I think that should answer your questions. The other question, I guess, is when you can get back to exercise. And it really depends upon how rapid your healing process is, whether there's a little crusting of the incision, which is not uncommon at the junction of the vertical incision and the horizontal incision. That may take application of some antibiotic ointment and Band-Aids for a couple of weeks, and it almost always just goes on to heal by itself. But remember, no blood thinners, no smoking, and kind of take it easy. Get out of bed, walk around, but be careful not to overexert yourself, because that can put more strain and stress on the skin and the healing process due to the swelling, which we don't want. Please call us if you'd like more information or would like to arrange for a consultation here in Beverly Hills. My number is 310-854-0031, and my staff will be very willing to answer any of your questions. And also visit my website at perlmanmd.com for lots of before and after photos in the gallery section and lots more information about both breast reduction and all the other surgeries that we perform on the face and body. Thank you so much for listening. I hope this was enjoyable and worthwhile and informative to you. And if you'd like, I'd love to meet you in person. Have a nice day.